My name is Dr. Magid Keramati. I'm one of the hand surgeons here at Northwest Hand and Orthopedics. I focus on pathologies or problems from the fingers to the elbows and perform surgery on issues that need intervention. Many of the patients I see don't always need surgery and are handled with non-surgical methods. These can include steroid injections and hand therapy, which we offer at our offices here as well. I make it a habit to answer the patient's questions at every visit, to spend quality time understanding their problems and needs. My goal for patient care is to provide the patient with advisable treatment and make sure that they are satisfied with that treatment. I don't think you can achieve this without spending time or listening to your patients. This is one of the insights I have observed through my training. I knew I wanted to become a physician in high school. My interest in surgery further developed while I was in medical school. My father is also a general surgeon and had a great influence on me through my upbringing as well as my education. Like my father, my initial training began through general surgery. It was my further interest in microsurgery which led me to a specialty of hand surgery. I have a great interest in performing procedures in the operating room. These often include complex traumatic cases and other pathologies which can be from wear and tear problems or overuse and misuse. One of my particular interests is with microsurgery, which I do here. Microsurgery is essentially surgery that is performed under a microscope. Usually these tissues are very delicate and should not be operated on with merely the naked eye. This is not a typical procedure that any surgeon can perform and requires extensive and additional training to be qualified to perform these types of procedures. I see traumatic as well as overuse and repetitive use pathologies. Nerve repairs are one of the most common microsurgical procedures that I perform here. Often these are traumatic in nature, either due to cuts with knives or saws. After the patients are brought back to the operating room, their wounds are cleansed and examined under a microscope. Each nerve is then repaired individually. It is a very delicate procedure. One of our strengths is the ability to schedule a patient's surgery within 1 to 2 days from their visit. Here, surgical patients often ask how long procedures last. The majority of hand procedures we perform are done within 1 to 2 hours. Teamwork is definitely a strength at our clinic. Our primary goal is patient care and patient satisfaction. We take a team approach in patient care, whether that means discussing with other surgeons about previous experiences and/or advice in dealing with more complex and difficult situations. Everybody's goal here is to ensure the best outcome possible. My personal practice involves our clinics at Shoreline and Woodinville. Many of our patients include major corporations in the area, including Microsoft and Boeing. I love working here at Northwest Hand and Orthopedics. It is truly a family away from my personal family. Everybody here is very welcoming and willing to help our patients. I have been part of the group since 2009 and have made the Northwest my new home. I started playing the violin at age 2 and performed throughout the U.S. through my college years. I love the symphony and other cultural events in the Seattle area, as well as nature and the environment. I'm Dr. Magid Keramati at Northwest Hand and Orthopedics, and I'm here to serve you.